the News Channel 5 network, this is MorningLine with Nick Barris.
Good morning, everyone. Thanks for joining us on MorningLine. Nick Barris with you here on a Wednesday, and a show this morning to talk about money and bureaucracy and health care and TennCare and Medicaid, and it can be confusing stuff, okay? But here's the thing, all right? A lot of what we're talking about today applies to a vast majority of us, and if it doesn't apply to you specifically, it probably does to someone else. And what's going to be good about today's show, I hope, is that we'll be able to sift through some of what's new that's being talked about by the governor at the highest levels in this state with regard to federal monies and how ultimately it will affect you, okay? So that's where you need to pay attention. We'll sift through it and try to make it not too complicated, though. That's not an easy thing when you talk about this kind of stuff. I mean, block grants and Medicaid and like I said, the B word, bureaucracy. We'll take your phone calls as well if you'd like to join in the conversation, if you keep up with us, but I'm interested in just learning myself as well. And we have someone here to talk about it. She is an attorney. Her name is Michele Johnson, and she is with the Tennessee Justice Center. Good morning. It's nice to see you again.
Thanks for having me.
Always a pleasure. You've been on before talking, and you know what I'm talking about. This can be confusing for people. I don't know that we'll get many phone calls this morning, but Medicaid, TennCare, it affects, in the state of Tennessee, how many people does it touch?
Well, it affects about half the kids in the state. Half the kids in the state rely on
mostly children, right? Yeah. And
then about 3/4 of the folks who are in nursing homes, long-term care, are seniors or rely on Medicaid. So it is 1.4 million people who rely on Medicaid, and those are children, seniors, pregnant women, and women with breast and cervical cancer, and parents of young children.
All right. Well, one reason we're doing the show today is the story from earlier this week where I guess Governor Lee announced or talked a little bit more in detail about his plan to seek block grants for TennCare, block grants, which would change the way the state receives Medicaid dollars. So, your eyes have just glazed over, right? Okay, but this is a substantial potential change to how things are done. And, all right, so if you could, and I know that you're not thrilled with this plan, but if you can lay out just from the governor's perspective, okay, what is it we're talking about doing here in terms of seeking block grants for TennCare?
Right, so basically, in this last election, healthcare was the #1 issue for voters across the country, but Tennessean voters said the #1 issue for them was healthcare. So this is because many people, healthcare isn't working. The healthcare system is not working for them. So the legislature and the governor feel like they need to do something on healthcare. What this is proposing to do is end a 50-year partnership with the federal government. Medicaid covers these core population, this very, very poor, very, very vulnerable folks. Right. The governor is proposing, the only governor in the nation to propose to end the 50-year partnership with the federal government and to say Tennessee is they're going to fix this system so that they can take a bunch of money from the federal government and not be accountable for it.
And that would be the block grant. Now, why would the federal government agree to this?
Well, so the federal government has said they want to block grant the entire Medicaid program.
Okay,
so they've tried to pass a law to say Medicaid will be, no longer will we have to face rising cost of health care and medical inflation, because of course medical inflation is something that is an issue for the whole nation. The federal government wants to get rid of that cost increase by block granting the whole thing, and the Trump administration has said they want to save over $1 trillion by cutting Medicaid or capping Medicaid.
Now, when you say, would not the block grants increase every year potentially, or could they? I don't know.
Right. So, I mean, I think what the Lee administration is saying is we're going to figure out a way. We're going to be the only governors to figure out a way to make money on this, and we can figure out a way to do it so it gets us more money. And my question to them is just, well, where are all the other governors? If this is such a great deal, where are all the other governors?
So, yeah, if the federal government under the Trump administration wants to go this direction, I'm assuming they've made this type of offer. Hey, let's go with block grants, and are you up for it? I guess you were telling me before the show that this went to Congress, and Congress didn't go along with it. So now the administration's saying, well, let's just go to the governor straight up and say, hey, look, we'll work with you, and we'll get the money for you this way. And so this is out there for all of the states. And is Tennessee the only one stepping up to try it at this point, Governor Lee?
Yes, Tennessee is the only one stepping up. And the article, as laid out in the Tennessean, said this is this is an experiment. And I guess Tennesseans, particularly children and seniors, really don't want to be the guinea pigs on this. We don't want to be experimenting on something that might increase suffering, and might make people's final chapter, really unbearable.
No, it is amazing. If you know anyone, or if you have a parent or a loved one who, you talked about seniors also are affected, that are in, nursing home care or an assisted living facility, or when they need to make the trips to the hospital, and they're all on fixed incomes. It's amazing, how, Medicare really helps.
Yeah. Medicaid is really.
Or I'm sorry,
important.
Medicaid.
Yes.
I'm sorry, I get those. Medicaid's what I meant to say. I apologize.
Yeah. Otherwise, people who've worked their whole life, and they basically in their final chapter, they need care. It costs too much for them to have it, and so Medicaid has been there as a safety net.
Well, and what it is a safety net. You don't qualify for Medicaid, as we've talked about in this show with some of our other guests. When you go to a nursing home, you think that that's going to pay it. No, you qualify for Medicaid when you are destitute. You have bank accounts. You still have some properties out there. I'm sorry, you should have to sell it and everything to pay for your care to the very end. You can't save that for your kids. That's the way it is. Because I don't want to pay for your tax dollars if you have resources. But once you're finally to the point that you have no more, and you've paid into the system, but that's it. Maybe aside from just your Social Security, that's when Medicaid kicks in.
It kicks in and it enables people to have their final chapter with some dignity.
Oh, it's huge. And, so, all right, where does this stand then? The governor then reaching out and saying he'll go this route. So I assume the administration will work with him. Is this a done deal? Is it something that has to be dealt with the legislature here as well?
Well, so it'll have to go back to the legislature for final approval, but the legislature here, this is about politics. Let's just be clear. Our legislature, block grant has been a political buzzword on the right for a long time, and it makes sense from a federal perspective. The federal government wants to lessen its cost, and so it makes sense from the federal government's perspective that they want a block grant. Things that by their nature are going to grow. It doesn't make sense from a state perspective, particularly from our state. We don't have an income tax. We're a poor state. Our citizens are pretty poor. So from our perspective, what it means is we're going to end up with our leaders taking the political hit for hurting seniors, hurting children, cutting services that then hospitals are going to have to bear the cost of, clinics and charities are going to have to bear the cost of. 22 cents of every dollar in the state budget is Medicaid funds. And we haven't, Governor Lee said that he was going to have a task force who was going to discuss what would work. And he said everyone should have comprehensive health coverage. Well, we still don't have a task force, and we're talking about a plan that will impact billions of dollars, taxpayer dollars, and we don't know what it is, but we know it works politically, but policy-wise, it makes no sense. If both the federal government and the state government say it's about getting the money, then the question is, one of them isn't telling the truth.
Are you saying then the block grant, if that came to fruition here, would it be then less money ultimately coming into the state than it currently is?
Absolutely.
Then why would the governor go for this?
Well, because politically he thinks it works for him. The Trump administration has reached out. He said, please be a leader in the nation and do this thing that is it great for a bumper sticker? It's great for bumper stickers. It's less.
Meaning to say that we're saving money. We can cut the budget, and that's kind of the ultimate thing, which it's all politically motivated. So it comes down to what the voters think, I suppose. And then if you can say, well, look at all this money we've saved, and they're saying they're going to take it by targeting the folks who require, health care through Medicaid.
Medicaid, yeah. If they want to save money, the question is, are they actually saving it, or are they just passing it on to, we're number one in the nation at hospital closures, and that's because our state has made decisions not to expand coverage, not to take federal dollars to expand coverage to the working poor. So these hospitals keep closing, and that means that if you're privately insured, you're driving, in one of these areas, a huge number of counties with no hospital, basically you might not make it to the next hospital. Medicaid is a huge payer of neonatal intensive care units, huge payer of burn units. If you're privately insured, you benefit from Medicaid being in this state and fully funding these services. If you block grant Medicaid and limit the number of dollars that are flowing into our state for that, it's going to have a real impact on those people, privately insured or otherwise, who rely on these services.
Yeah, because you're going to have folks then that have no coverage and the money's not coming in, which of course, as always with insurance, it's passed on to those who do have money.
That's right.
So I'm just trying to say, if you're someone who just doesn't give a hoot about the poor that are going to suffer because of this, you can still turn it around on yourself and realize that, well, you're going to pay for it, because someone walks into an emergency room with horrible burns on their body, they're not letting them walk out of there. Someone's going to pay for that care.
That's right. Well, the other thing is just just the state budget. The state budget completely relies on Medicaid, and so if you limit the number of dollars flowing into the state by Medicaid, it's going to be seen in other areas like education and other state services.
All right, we'll take a break. We'll see what some of our viewers think as well. We've got some phone calls coming in, which is great. If you have questions, if something hasn't been explained quite right, if you are in support of this idea or against it, we'd like to hear from you. The number on the screen. We'll be back with more and our fine guest right after this.